Welcome everyone. I'm John Kelly from NGGPE, and this session is on how to use the TRIP database. And we're going to start from a patient question and take you through how to find an article using this database. So here's the setting. So you can imagine you're in a remote Indigenous community and you've just seen a 3-year-old boy with bilateral acute otitis media on the basis of finding bilateral ear bulges on otoscopy, and he's asymptomatic, and you notice had a previous left acute otitis media 6 months ago that has settled, and you've offered him a 7-day course of amoxicillin with his parents, and as a good clinician does, you got them to take the first dose in the clinic, and you noticed that the child doesn't tolerate the first dose very well, and the parents have enormous difficulty. And when you explore the values and beliefs of the parents, you realise that they're quite keen for this child to have amoxicillin. It's just that they really have their doubts that this child's going to complete a course. And using your clinical experience, you've recall somewhere that single dose azithromycin is an option for single dose therapy, and I think you might explore that. So from an evidence-based trial point of view, you've got the patient's values, that you've got parents keen for this child to complete a course of antibiotic for the acute otitis media. From your clinical experience point of view, you know that in high-risk Indigenous communities, you really do need to give an antibiotic to treat this asymptomatic ear bulges effectively to prevent complications in the future. And your clinical experience does recall that there is a single dose therapy that might be a possibility. And you might, fully utilising that clinical experience side of the evidence-based triad, maybe consider asking a colleague or look up any review articles. But in this setting, you also decide that you might look up the best available evidence yourself. You already know from clinical experience that azithromycin is quite well tolerated, so your particular interest is more whether it's effective, and so that becomes your reason for going into the best available evidence. So how do we do that? Well, if you might recall that when the first step you do when you're deciding to use the best available evidence is you need to translate the situation into a question, and the question and what you really want to know is what's the type of question you've got, because this will decide for you the best study design, and you want to frame the question into a PICO, because with these two bits of information you can do your searching in the database. So in terms of what the question type is, in this case it's a therapy question, and in which case the ideal studies to answer your question are randomized controlled trials, which is level 2 evidence, and systematic reviews. So that's what you're going to aim for and look for when you do your database search. In terms of the PICO, let's go through the PICO. There are 2 reasons you do the PICO. One is to help you actually find the article. So you're matching the PICO of your patient with the PICO of the papers you're looking at in the database. The other reason ultimately is because you want to see if you want to apply an article that you found. So when it comes to reading a paper, one of the key things is to see how well the PICO of the paper matches the PICO of your question. So you can think that you're doing a PICO at this stage with 2 purposes in mind, in effect. One, to find the article, and the second one, to decide how well you apply it. Okay, so let's have a look at our P. So in this case, we have 3-year-old child from a remote Indigenous community with bilateral asymptomatic acute otitis media based on the finding of ear bulges in both ears, who's had 1 previous episode of left acute otitis media 6 months ago. So that's your population. Now, from the point of view of applying this, an article you eventually find to a patient, all that detail is very useful, because you'll be trying to match that as best you can with the article you read. From the point of view of finding an article, realistically you're not going to find an article that perfectly matches that population. So, but what you often might do is set what's the minimum you'll accept and what's the max. I mean, there's the ideal and then there's the minimum of what you will accept. So the ideal would be to find articles on, set in Indigenous communities, preferably in Australia or the NT, with asymptomatic bilateral acute otitis media in young children, so 3-year-olds or under 5-year-olds. But realistically, you will have a minimum that you will accept too, and that might be quite simply acute otitis media of any sort in any population, because realistically, so you're trying to set a minimum of what you will accept when you're trying to search a database, and then of course there's the ideal. We do the same with the intervention. So the intervention here is a single dose of azithromycin, and you've got to ask yourself, okay, in realistic terms, is there a minimum? That's the ideal. Is there a minimum that you would accept? Would you accept like any azithromycin, even if it's repeated dosing? In this case, the whole point is I want to apply a single dose. An article on repeated dosing azithromycin isn't actually going to help me know whether I can give a one-off dose for this child. So I probably would be a bit strict here and say, yep, I really only want to look up single dose azithromycin. You then go to the comparator. So in this case, the comparator, I guess strictly speaking, is a single dose of amoxicillin, which is because that's what the child's currently going to get, based on the fact they're not going to complete their course. From a pragmatic point of view of searching an article, I guess there would be two I might accept as minimum. One would be a placebo of azithromycin versus placebo. That would probably be my close to ideal, because that's closest to what this child's going to get. A child's in effect going to get what's basically a placebo anyway. A single dose of amoxicillin is unlikely to do anything. So that would be my preferred control. However, I'd probably be accepting any equivalent studies where azithromycin is compared with any other standard courses. Single dose of azithromycin is compared with any standard courses of any antibiotics that I would use for acute otitis media. So I'll accept either of those in my search. And then in terms of the outcome, well, the ideal outcome here, because it's an asymptomatic child, this is typical in Indigenous communities, most children with acute otitis media are asymptomatic and just have bulges. In that case, the ideal outcome you're looking for is a resolution of the bulge, and happens that in studies I usually define that as a halving of the size of the bulge. So I'd be ideally looking for an outcome that has something to do with the bulge. However, in terms of accepting a minimum requirement, I'll probably accept any symptom or sign of resolution of acute otitis media in my search. So what we've done there is got clear in our head exactly what we will and won't accept when we're doing our search, which makes it a lot quicker when you go looking for articles. So we've now got our question type, which has helped us work out in this case that we're mainly after RCTs or systematic reviews of RCTs. That's what we're really hoping for. And we've got our PICO, and including what's the minimum we're going to accept when we're looking at the articles and trying to match them with our question, so we can decide whether to choose that article. Now, of course, then you go to a database, and you have to bear in mind that it's equally important to look up pre-appraised research as it is to do primary research. So we want a database that looks up all these, and as I've explained in previous YouTube clips, TRIP database is quite very handy with this. It's not so crash hot with the evidence-based textbooks, so you might want to specifically look up one of them in addition to TRIP database. And the best two are Dynamed and UpToDate. Dynamed, if you get a 3-month, you get a so many months free trial, and at least when I tried it a few months ago, it was actually included in TRIP database, but when I tried it a few weeks ago, it wasn't. But I don't know if that's just because my 3-month free trial ran out, so I don't really know. But anyway, so here's our TRIP database. So let's go into the database. That's the website. Quite frankly, just Google TRIP database, it will turn up. This is what the page looks like. It's good to click Pico here if you haven't already, and that helps you. And this is where you enter your search, which is a lot easier than PubMed. PubMed, which is very good at primary research and systematic reviews, can do a better search for those articles, but you've got to do what's called mesh search technique, and unless you know how to do that, well, quite frankly, you're going to get just as good a result out of Trip Database. So I find this does for me. So you type in what you're interested in. So you might see I'm not trying to, if I wrote in all the detail of my Pico, I'm not going to get any hits. If I wrote just ear disease, I'm going to get millions of hits. So I want something in between, and this is the kind of in between sort of thing I might put in. You might notice I only just put in 1 or 2 of the Pico. So in this case, I've decided the population and intervention. When you do that, it'll come out like this. Now this is a bit annoying because it has this word title, and that means it's only going to search the titles of all the literature out there. And if that title has the titles media or azithromycin, it has to have both. It will present it as one of the articles for you. Whereas Trip Database can actually search by abstracts and even the available free text. So what I do is I actually physically rub out that word title, so it looks like that, and now it's going to fully search abstracts, title, and the actual free text of the article, which is much better. So when I do that, I get, I think what it looks like 208 hits there. And on this left-hand side is all the articles, and if you click each of these, you'll get the abstract. You'll notice that for some of these articles, it'll tell you the estimation of bias. So for the primary research, it'll give you an idea of how much bias there is. You remember back to internal validity, and it'll tell you what sort of articles it is. And on this right-hand side, it's got all the different forms of literature out there. So and how many of each it's found, and you can click each of these and it'll just present those ones there. So that's how this thing is structured. Incidentally, you might notice here there's a thing called Become a Pro. So you can pay money to get a bit more access to what's available in the literature. I haven't done that. I find that a lot of the key literature is available in the free version, but it's something that's worthwhile knowing, I guess, particularly if you become a serious Trip Database user. And you might notice here that it'll tell you how many extra articles you could get if you paid the money and became a pro. So let's look at that right-hand column. So what you can see is that what they've done is they split it into some of the pre-appraised research. So there's the systematic reviews, the evidence-based synopses, the guidelines, and down here is the evidence-based textbooks. These ones here I kind of ignore. Same with that. And you can see it tells you how many of each one, and you can click each of these and just present those ones for you. And in terms of the primary research, the key one here is here, so primary research, so 76 articles, and under that they've also got which ones are actually controlled trials, so randomized controlled trials and controlled trials that weren't randomized. So they are there. Key primary research, there's the world's top 5 journals in the opinion of Trip Database, and I guess they're usually quite high quality in their internal validity, and they, as a general rule, lots of exceptions, but and it's just saying how many from those. So the total here of the primary research is 76, of which there are 44 controlled trials, and three of the primary research are presented in leading journals. So that's how they work. And you also can see what's called ongoing systematic reviews and ongoing clinical trials. These are ones where they haven't been published yet, but you can sort of get a bit of a sneak preview of if there's any literature that's about to come out. So essentially what I do in terms of using TRIP database is I just click each of the pre-appraised research and then the primary research, and to see what and just match to what I want. So I'll click systematic reviews, then I'll go click synopses, and I'll click each of these guidelines and have a brief read of what it says, and then e-textbooks if I've got access to Dynamed. And that might be what I'll specifically look. I don't really spend too much time on the other e-textbooks, but there are others out there that you can be able to see in here. And then I go to switch and go to the primary research, and given I'm really interested in controlled trials or randomized controlled trials only, I would probably just go and click that one there, which has got 44 articles, because that's probably all the ones I click here. So let's click this one, systematic reviews. You might notice if I did spend the money and become a pro user, you'll get an extra 4. But I'll get my things like Cochrane reviews and all that, but they'll all be in this other 14 because they're all free on the web. The ones that are free that you can get normally will be in this 14. Okay, so when I click systematic reviews, this is what I get. And so you can see here's the hits, so there'd be 14 of these. And if I click one of these, it'll give me the abstract to them. And I click them again, I might get the full text if it's available for free. And this thing that says 14 results by quality, what that means is that as they've regarded quality, so in other words, things like the internal validity of the article, that they will put the ones with the highest quality up here at the top and those with the lowest quality down the bottom. I don't know how they base quality for systematic reviews, so I don't know how useful that is for this, but it's very useful for primary research, where it really does put the ones with the low estimated bias up at the top. So anyway, so that's our search by, if we do by quality. Now let's change that. You can change it to, say, search those 14 results and present them by date. So let's do that. And now you can see that the newest ones are up the top, which happens to be a Cochrane from 2010. And you can see as you go down, the dates get older and older. So here's a 2001. So that's how you can play with that. Okay, so this is the first article. We click that to get the abstract. And when you look at this article, you realize that this is a systematic review addressing a therapy question, so that's good. Therapy questions are best answered by randomized controlled trials, a systematic review of randomized controlled trials, and it does appear that this is a systematic review of randomized controlled trials, so that's good. Now I'm going to match my PICO with my minimum requirements of a PICO. Well, okay, from a population point of view, it's children with acute otitis media. That meets my minimum requirement. In terms of the I and the C, though, it doesn't meet my minimum requirement. My minimum requirement is I wanted single doses of azithromycin as my intervention, and in this case that isn't specifically being addressed in this article. So it probably doesn't quite meet my minimum requirement in that regard. This is the intervention comparison here. It is something different. So I'm not going to go any further with this article. We'll move on to the next. So you keep going down. So let's have a look at another one here. Increased clinical failures when treating acute otitis media with macrolides, a meta-analysis. Well, that one, let's open that one. That might see what that shows. So it's a systematic review of RCTs, and it's a therapy question, so it meets that criteria. When I try and match my PICO, well, the P is pediatric patients with acute otitis media. Okay, so it meets my minimum requirement of the population. In terms of the intervention and the comparison, well, this one's interesting. It's comparing antibiotics with dose ranges between and regimens between 5 milligram per kilogram per day to 30 milligram per kilogram per day, once or twice daily for 1 to 10 days. So it does. So this systematic review is a whole bunch of studies. It is possible that one or two of the articles that forms the basis of the systematic review is going to include an article on single dose of azithromycin. It's a little bit roundabout in that systematic reviews basically get a whole bunch of articles together and make an overall conclusion. So this overall conclusion on this is not going to be specifically about single dose of azithromycin. So it's not ideal of what I'm after, but when you look at this, the comparison, it's going to give me a bit of an idea whether azithromycin in general as a drug is inferior to standard dose regimes. So is that meeting my minimum requirement? Probably not quite. If I can't find anything else, maybe it might give me a bit of an idea, but I wouldn't quite. I don't think this is quite. I'd like to see there's something better out there. This is a little bit indirect at answering my question. And so you just keep on going through them in that same way. And the idea is you can often work it out from a title like Economic Evaluation of Antibacterials in the Treatment of Acute Sinusitis, clearly off the mark. Treatment of acute otitis media with shortened course of antibiotic, meta-analysis. Again, the problem with these systematic reviews is that they, at the end of the day, you can only apply it to a much broader set. It won't, if it's not a specific systematic review on single dose of azithromycin, you'll never quite get your direct answer. So I'd have to say as I go through this, I'm really not finding something that's specifically trying to address my minimum requirements of my PICO. So I'm going to move on. You can go to evidence-based synopses. There's one of those, and it's something from the UK Teratology Information Service. I don't think I'm going to bother that. That's clearly going to be off the mark. I go to my guidelines, and with the guidelines, often what you do is you just find, you might look at the title and then might just head to the part of the guideline that you think might address your question. And in this case, none of these actually specifically address it. I did look at this one, the Canadian Society Management of Acute Otitis Media ones. This is just looking at the Canadian guidelines. Azithromycin use in pediatrics, I might have a look at that to see if it's got anything specific. This one here on rhinosinusitis is off the mark. Antibiotic stewardship sounds like irrelevant. Uncomplicated pneumonia. So I might open that one and just see if they have anything that remotely addresses my PICO. But if it doesn't meet my minimum requirements, I move on. So I think here's from one of those guidelines we've come to this section here. This is that first one. And it just points out that macrolides are an option. However, these antibiotics generally have inferior bacteria-killing capabilities when compared to beta-lactams. So, I get something out of this. I might see if I can find a reference that they're referring to. So I'm getting a vibe that maybe it's inferior to beta-lactams, but that still doesn't answer my question whether azithromycin single dose is better than giving nothing at all. In fact, the fact it's even labelling it as an alternative option gives me a bit of heart that it must have some activity. But again, it doesn't tell me specifically about single dose therapy. So, So anyway, I move on. And you keep on going through the guidelines. This is the British ones. They're often the NICE guidelines, and none of these. I'd look up this top one. Unfortunately, it doesn't really help me either. And keep on going down through them to this one, which is the US guidelines, and I might click that one. That looks relevant. And again, it doesn't really tell me what I want to know. It says this. It says pediatric patients over 2 months and adults that they would give high doses of azithromycin in people allergic to amoxicillin. So it's giving me an idea that, okay, it's a not unreasonable antibiotic, but it still doesn't tell me it's about single dose. It doesn't meet my minimum requirements in my PICO here. And then you can go to your e-textbooks. These are the ones that are available for this particular question, and you can see if sometimes sometimes e-medicine can give you a bit of an idea. I've now done my pre-appraised research. I go to the primary research. So here's my options here. This one, that one. There's the controlled trials. There's the total primary research. There's ongoing clinical trials. Now, because the types of studies I'm interested in looking at here to answer my question type are randomized controlled trials, I really just click the controlled trials section here, and I come up with 44 hits. And what I simply do is go through each of these, reading the title and seeing how well they match the PICO of my question. So if you go down through these, this first one, single dose extended release of azithromycin versus 10-day Augmentin for the treatment of children with acute otitis media, that sounds like it might meet my bare minimum requirements, so I might tap the abstract, and even if it still meets the criteria, pull out the article. The only thing that concerns me is what extended release azithromycin is. Is that the same as azithromycin we use in Australia? Just from looking at that title, but anyway, I think that meets my minimum requirement, so that's a keeper. Next one, here in the second article, the outcome is something to do with azithromycin pharmacokinetics, so that's not very relevant, so ignore that one. The next one, single dose azithromycin versus 7 days of amoxicillin in the treatment of acute otitis media in Aboriginal children, a double-blind randomized controlled trial. Well, that clearly does sound like it might meet my PICO. So I'll certainly be keeping that one, or pulling the abstract, and if it meets it, keeping it. You might notice that they do have their comments about estimated bias. This one they think is low, this one's high. My experience is that actually does correlate quite well, but at the end of the day, I don't know quite how they came up with that, and I'd rather still make my own internal ability assessment. But I guess, for those that aren't very skilled in running through a checklist of for bias and things like that as part of your internal validity, I guess this might help you. And anyway, just keep on going through the other 44. When I go through the rest of the 44, there's only one other keeper. Just looking at the titles, I'm able to rule out the others quite quickly, so it doesn't take that long. And that was this one here. That's the only other keeper. Single dose of azithromycin RCT versus high dose amoxicillin for uncomplicated acute otitis media. So they're the 3 articles that I've identified from my TRIP database search, and they're the only 3 things I'm going to read up on. So just to summarize what we've just gone through, we've started off with a clinical scenario. And in everyday use, we're really make our decisions in the setting of the evidence-based triad, which is where you're looking at values of the patient and your clinical expertise, or the expertise you could call on of other people, and best available evidence. And in this case, we found that there's a role for looking for the best available evidence to answer a very specific question on single dose azithromycin and its effectiveness in treating acute otitis media, and that to go to the best available evidence, we said that you really need to divide your question and work out what the question type is, because that'll tell you your ideal study design, and to frame your question in terms of a PICO. And that the reason we do the PICO is in the immediate term, so that you can search your database effectively and match the articles with your PICO. But in the longer term, when you finally pull that article, it's so that you can actually decide whether how well that article applies to your patient. And we pointed out that for that immediate goal of trying to find the articles, you really need to set a minimum of what you would accept for your P, your I, your C, and your O. We then talked about how to use the TRIP database, and what you'll notice is that we were systematically going through the pre-appraise, followed by the primary research, systematically through TRIP database, and what we were primarily selecting the articles on was their appropriateness at being the appropriate study design to answer a therapy question in this case, and how well the PICO matched your whether it met your minimum requirements of the PICO that you had set. So I hope you found that useful. I hope it wasn't too threatening in terms of, not too overwhelming, I should say, and I hope you go out there and start searching and getting some good answers for your patients when it's appropriate.